Good morning. For this session, we are going to discuss about documentation in physical therapy. So questions like why do we document, how do we document, when do we document, what do we document will be answered at the end of this lecture. So at the end of this session, you should be able to do the following. So the objectives of this particular lecture are listed from numbers 1 to 6. So at the end of this lecture, at the end of this session, please go back to this slide and check if each or all of the objectives were met. The first question that we need to answer now is, what is documentation? So from this slide, you'll know that a documentation is a written communication. So notice that the word written is actually highlighted. Okay, so you have here written communication related to patient encounter. Okay, so any patient encounter in the clinics may warrant a written documentation. So it encompasses the preparation and assembly records to authenticate, okay, and communicate the care given by us, PTs, or any other healthcare professionals, and the reasons for giving that care. Okay, so all the important keywords are highlighted in yellow. Okay, so documentation is a written communication based on your patient encounter to authenticate, communicate the care given by you or any healthcare provider and your reasons for giving that particular care. Okay, so that is documentation. Now that you know what a document is or what documentation is, the next question is, who needs the documentation? Who needs the medical document? Who wants the medical document? Who writes the medical document, or who reads the medical document? So this is the first question. Well, from the pictures, it will show you that, well, for one, okay, the doctors may write or read the medical document. Okay, another one, we, the physical therapists, the PT assistants, PT aides, PT students, okay, the physical therapist supervisor, or the occupational therapists, and the speech language pathologists. Okay, another group of people who may need the medical document would be, surprisingly, the patient's family. Well, of course, not all of the members of the family may access the document. Okay? If the patient is conscious and if the patient can comprehend, the patient is the one and only member of the family that may have access to the document. But in circumstances when the patient cannot understand or the patient cannot read the document, then the patient may authorize a member of his or her family to access the said document. Okay? Well, who else? Who else need the document? The third party payers or the insurance. Here in our healthcare system, it's really not that common, no? Pero you may, um, if you are familiar with healthcare insurances, so let's say PhilHealth or MaxiCare, if that's familiar to you. What else? Coco Life. Okay, so sila yon yung mga insurance. If they cover physical therapy treatment, then they may pay for the sessions, okay, that you are attending. And if you don't have the document, if the PTs do not write the document, then these third-party payers won't pay you for the services that you rendered. So it's very important that you write your document so that you get paid. if in cases no na third party payers pay for the patient's PT session. And then lastly, the legal system, no. So PT document or a medical document is a legal document. So whatever it is that you write in the document is legal, authenticated, okay? So hindi mo siya pwedeng i-alter because in times when the patient, for instance, no, sue you for something that you did, okay, so the PT will always go back to the document. So kung hindi niya sinulat, sometimes no, may qualify sa negligence. And you may get sued for that. So it's very important to write all the correct and real, true findings ng patient. We do not do estimations. Okay, we do not do crude estimations. That's why we need to be objective in all that we do. Okay, so now, since we already know what documentation is, we also know who needs the documentation, who writes the documentation. The next question is, what are the purposes of documentation? Why do we document the findings? Why do we write all our findings? Why do we do documentation? Well, all the purposes, all the reasons why we write the PT note, okay, are listed from numbers 1 to 5. So let's go to number 1 first. Number 1, why do we document? To gather information, to provide comprehensive physical therapy care to a patient or client. Okay, so very important. Why do we document? Gather information. How do we gather information? We interview the patient, we assess, we examine the patient. Alright, what's the second reason why we document? To review the patient or client's progress. Okay, review the client's progress or status so that you can make further healthcare decisions. Now, we do not only write a PT document or PT notes once in the entire sessions, okay, that you render, okay, to your patient. Okay, so we do or we write the document every now and then. So it varies from one facility to another. But the most common practice is we write the PT note every PT session. So in that case, the PT will be able to monitor the patient's progress or the patient's status. From the very first evaluation, so what you call the initial evaluation, you will now compare. Nag-i-increase ba ang function ng patient? Nag-i-increase ba yung ROM ng patient? Nag-i-increase ba yung muscle strength ng patient? Okay? Nagiging independent ba yung patient when doing a particular task? Okay, so very important si documentation. The third reason why we document is for external and internal audits, so record keeping and clinical reviews. No? In big hospitals, very important sa kanila si external and internal audits because auditors, no, go to the clinics and check for their files if they are all complete. Okay, so important yan. The fourth reason is the verify claims of physical therapists for services rendered. So for this reason, specific dito yung sa third-party payers. Okay, so again, you won't get paid if you don't document everything that you did kay patient. Okay, from the interview down to the list of the treatment that you rendered. Okay, and then number 5, determine reimbursements for services rendered. So numbers 4 and 5 are related, no, when it comes to third-party payers. Okay, so all the reasons why we do documentation are listed from numbers 1 to 5. Okay, so now that almost all the questions now are answered, we now go to, if not equally important, or the most important question, the most interesting question to ask. How do we document? Okay, so the question, how do we document? Okay, so there are two ways of documenting. Okay, what are these two ways? Okay, number one is the source-oriented medical record keeping system, or the SOMR. Okay, and number two is the subjective, objective, assessment, and the plan format. Okay, or in short, it's the SOAP format. Right? Okay, so we have two formats, no? The SOMR and the SOAP format. So between the two formats, okay, we have here now the SOAP format and then the SOMR format. The more commonly used in the clinics will be the SOAP format. Okay, it's the SOAP format. So again, the SOAP format stands for, S stands for subjective, okay, O stands for objective, A stands for assessment, and then P stands for plan. So we have here the SOAP format. Again, the SOAP format is divided into 4 sections. Okay, paulit-ulit tayo. Why? Because this is the more commonly used in the clinic, so you will be encountering this format very often. Okay, so again, the SOAP format, the first heading is the subjective. The second one is the objective. Third one is the assessment. And lastly, you have the plan. Okay, for the subjective, so you have here, for the subjective part, subjective is basically patient interview. Okay, so you can see in the picture, the PT interviews the patient. Okay, so this includes all the patient's symptoms. So when we say symptoms, this one is objective or subjective? This one is subjective. Okay, subjective. Right? In which the data are obtained from the patient's interview. So all information will be coming from the patient. The source of the information could either be coming from 1, patient, 2, the caregiver, if in case the patient cannot talk, okay, or if the patient is unconscious. Okay, so again, for the subjective, since this is coming from the patient, it has several subheadings. Okay, so under subjective, nandyan si demographics, which we will be discussing one by one later. Okay, number 2, it is the chief complaint. Okay, number 3, it's the history of present illness. Number 4, it's the past medical history. Five, lifestyle. 6, it's the physical environment. Okay, 7 is the social environment. And then lastly, you have the patient's goal. Okay, so all of these elements will now comprise the subjective part of the PT note. So now we go to the objective part of the SOAP format. So objective, this one now includes the signs. Okay, so this one includes the signs. Signs, unlike symptoms, are objective in nature. Okay, so the physical therapist gathers the factual data from the examination or the assessment. So if all the subjective information come from the patient, all findings written under objective will now come from the physical therapist. So what are the examples of findings documented under the objective heading? So a few examples will be, of course, vital signs. Okay, this one is palpation. Okay, so the PT is checking here if there is tightness of the gastrocnemius. Could also be that the PT is checking for the end feel for ROM. Okay, this one is functional analysis. So the PT is examining the patient's level of independence or dependence when doing sit to stand. So in this picture, the patient was initially seated here in the wheelchair, and then the PT asked the patient to do sit to stand, and then look at the patient, okay, holding the parallel bars and the PT's hands on the chest. Okay, and then lastly, the fourth picture, this one is for the ROM. So you can see that the PT here is using the goniometer. Okay, so you actually have a lot more under objective. You have MMT, you have special test, you have gait analysis, you have postural analysis. Okay, you have ocular inspection, you have sensory assessment, okay, and a lot more. Okay, so this now, all these examination procedures will now fall under the objective part of the SOAP format. We now go to the assessment or the A part of the SOAP format. Well, the subjective and the objective part are the bulk of the musculoskeletal examination subject. Okay, while the assessment and the plan will now be covered by your musculoskeletal evaluation and treatment. So that's for the next term. But just for now, for you to know, okay, what are under the assessment part. So in here, you have the patient's problems, the identified patient's problems. Now, how do you identify patient problems? From the examination. So this now, the assessment will now include the evaluation, the diagnosis, and the prognosis. In our case, because we do not diagnose the patient's condition because the doctors do that, this is now called the PT impression. Okay, all these and more will be discussed next term, okay, in your MSK2 course. Next is the plan. The plan or the treatment part. Okay, so in here, you will find or you will see the list of the different physical therapy management or rehabilitation plan for the patient. So in this picture, you can see that the electrodes are being placed on the patient's thighs. Okay, so this one is electrical stimulation. In here, you will see that the PT assists the patient, okay, while the patient is doing aerobic exercises. Okay, and then in this picture, you will see that the PT right here assists the pediatric patient while doing the vestibular ball exercises. So we have a lot. We have a lot of PT interventions that will all be documented under the plan part or the treatment section. So now that you know the two common ways of documenting physical therapy findings, okay, we now go to the types of physical therapy notes. Okay, so we have four basic types. Okay, so the first type is the initial evaluation. Okay, so initial evaluation, from the name itself, this one is done, okay, during the first PT session. So from the name itself, initial. This one is very comprehensive in nature. So you're going to do the subjective part, you're going to examine the patient under O, you're going to write all your goals, okay, for the patient, and then a comprehensive list of PT treatments that you will render. Okay, so initial evaluation. So for the entire PT sessions, okay, usually in our clinics, especially if it's musculoskeletal, okay, if it's musculoskeletal case, the most common number of sessions would be 6 PT sessions. Okay, in our case lang so that's 6 PT sessions. So for the entire 6 PT sessions, how many times do we do initial evaluation? Okay, only once. Okay, we do it only once. The first time we meet the patient on the patient's first PT session, you are going to conduct initial evaluation. So for initial evaluation, this will now be your baseline. Okay, so you are going to compare your succeeding examination from the findings that you got during the initial evaluation. So this, okay, now you will see if the patient is either regressing or if the patient's status is improving. So initial evaluation is very important. We don't miss this. As PTs, we always do initial evaluation. Okay, what's the second one? Okay, the second type is the progress notes. So this one, the timing of writing the progress notes differ from one facility to another. So for progress notes, very common in the facility that we write progress notes, okay, every PT session. So if we only do initial evaluation once, in all of the 6 PT sessions, for progress notes, we do it in all 6 PT sessions. Okay? Granted na 6 PT sessions lang yung ibinigay ng doctors. So each time you meet the patient for his or her PT session, we write the progress notes after. And each time you finish one progress note, you always go back to either the previous progress notes, okay, to check if the patient is improving, or compare it to the initial evaluation. Okay, what's the third one? The third one is the re-evaluation notes. So re-evaluation notes, this is done before the patient goes back to the doctor for re-eval. Okay, so before the patient goes back to the doctor, in here the doctor will examine if the patient needs more PT sessions or if the patient is already a candidate for discharge from PT session. So when do we do re-evaluation notes? So going back to our example just a while ago, so if the patient was prescribed with 6 PT sessions, for instance, okay, during the 6th PT session, after the 6th PT session, the patient will now go back to the doctor. Now, when do we write the re-evaluation notes? Normally, in the clinics, it's either during the 4th PT session or the 5th PT session, the PT writes re-evaluation notes. Okay, so for the PT to be able to examine if the patient really did improve, okay, the PT will now compare the IE versus the re-evaluation notes. Okay, so the re-eval notes is always compared side by side with the initial evaluation. Okay, and the fourth type of the PT note is what you call the discharge summary. So when do we write the discharge summary? When the doctor says, or when the doctor now says that the patient is now ready to be discharged from PT. So this, no, if the doctor sees, no, na halimbawa yung patient na-achieve na niya yung kaniyang pre-injury level. Okay, na-achieve na ng patient ang pre-injury level, or the patient is already highly functional, okay, then the doctor may now discharge the patient from physical therapy. So these are the 4 types, okay, of PT notes. So the documentation, or the PT documentation, actually emanated from the International Classification for Functioning, Disability, and Health, or the ICF model. So this one, I believe you already encountered last year in your Introduction to Physical Therapy. So what exactly is this ICF model? So in here, okay, the graph, okay, or the picture will show you how the ICF model actually looks like. So from the disease, okay, so from the disease right here, okay, on top, will emanate 3 divisions. Okay, so you have here, the first one is the body structures or functions, okay, and then the activity, and then the participation. Okay, so any problem with the body structure or with the body functions will now be called the impairment. Okay, so what are the examples, or what are the common examples of an impairment? So one is pain. Pain is an impairment. 2 is limitation of motion. LOM is an impairment. 3 is weakness. Okay, weakness is an impairment. Okay, so those are the common types, or the common examples of impairment. Activity, when disrupted now, is what you call the activity limitation. Okay, so examples will be 1, difficulty in walking is an example of an activity limitation. Okay, difficulty in donning and or doffing clothes, an example of an activity limitation. Now for participation, if the patient's role in the society is already disrupted or is already affected, then that is now what you call the participation restriction. Okay, so if your patient, for example, is a chef, your patient's role in the society is that of being a chef, then participation restriction of your patient is Okay, difficulty preparing food, or difficulty cooking. Okay. And then, under all three, you have the contextual, okay, or the environmental and personal factors. Okay, so we have environmental factors, we have personal factors. So could be that under personal factors, included dito yung patient's present medical condition, such as diabetes mellitus, hypertension, asthma. Depends, no, what personal factors affect the person's function in the society or the person's activity. Environmental factors will include work setup, okay, home setup, okay, or work environment, home environment. All right, and they are all interrelated to each other. So this arrow here will now tell you that the environmental and personal factors will affect the body structures, will affect the activity, will affect the participation. Okay, so we now go to writing the physical therapy document. So to start, okay, we need to know, okay, the different evidence-based practices integrated when writing a clinical document. Okay, so you need to take note of the following. Number one, you document test measures that are, number one, valid, and number two, reliable. Okay, when you say valid, the test that you will use should measure what it is supposed to measure. Okay, so one perfect example is goniometer. So what is goniometer for? To measure range of motion. So the goniometer is a valid tool for measuring the range of motion. Okay, how about reliability or reliable? How do we define reliable? This one is the repeatability of measure. Example, okay, for your first goniometric measurement, for instance of hip flexion, you know that the normal value of, or the normal range of motion of hip flexion is 0 to 120 degrees. So for you to be able to say that the tool that you are using is reliable, okay, the reading that you will be getting from the first time you use it, and the second time, to the third time, up to the fourth time, up to the last time, okay, that you're going to use the tool, basically you have the same reading. So if during the first session for hip flexion, the results gave you a 0 to 110 degrees. For the second session, it gave you 0 and 110 degrees. For the third session, again 0 and 110 degrees. And then for the fourth, still the same value. Then this one is a measure that the tool that you are using is actually reliable. Okay, so you get the exact same measurement each time you do the assessment, or each time you use the goniometer when measuring the range of motion of hip flexion. Another thing that you need to consider is that we use standardized outcome measures. So we have actually a lot of standardized outcome measure. Examples would be the subjective pain scale, that's very common, or the visual analog scale for pain level or pain intensity. What else? MMT is actually a standardized outcome measure tool in measuring muscle strength. The different questionnaires, okay, that we use, okay, in our assessment, like the IPAC, for instance. Okay, so this one measures the level of physical activity. Okay, we have the WOMAC questionnaire. This one for osteoarthritis. Okay, we have the Roland Morris questionnaire for back pain. Okay, we have the FIM for function, or the functional independence measure. So we actually have a lot, and we have a separate lecture for these, no, for the standardized outcome measure. Okay, what's important is that you're going to use, okay, valid, reliable, and the standardized outcome measures in your assessment. Okay, the third one that you need to consider is the selection and the implementation of an appropriate plan of care based on research or clinical guidelines. So in our practice, okay, we now use the term, okay, evidence-based practice. Okay, so we choose physical therapy interventions that are actually backed up by research, because there are some that are already considered not effective because of several researches, because of several studies. Okay, so in selecting or in implementing the different treatment that you will render or you will give your patient, you need to back it up with research articles or studies. Now, how do we make the PT document concise? So you have a lot here to consider. Okay, so to start, okay, number one, concise wording, abbreviations and medical terminology, the use of template, avoid leaving blank spaces, or the use of person first language. So we will be discussing each, okay, as we go along. So concise wording, what do we mean when we say concise wording? You make all points clear and succinct. It means you don't go beating around the bushes. It's direct, it is straight to the point. Okay, and you omit the unnecessary and irrelevant facts. Now, when you are actually interviewing the patient will sometimes tend to do more of a storytelling than, the answers that you want from the patient. So, you cannot just interrupt the patient and say, okay ma'am, hindi na po natin kailangan yan, tigilan nyo na po yan. You cannot say that. Okay, you just learn how to filter the information coming from the patient. Okay, so learn how to filter the important and the relevant facts and information that you think will help make your assessment and the document concise. Okay, so the number one rule is no beating around the bushes, straight to the point. The document should be direct. The next thing that you need to consider is the use of the abbreviations and medical terminology. So in your Introduction to Physical Therapy course, you are already introduced to the different medical abbreviations and medical terminologies that will be helpful for you in writing a PT document. So, few examples for abbreviation and medical terminologies are the following. No, number one, ROM, you know that it stands for range of motion. TX actually stands for traction. OD stands for once a day. ANT dot stands for anterior. Okay, BUN stands for blood urea nitrogen. MMT stands for manual muscle testing. BID is twice a day. MD is medical doctor. RX is either treatment or prescription. STAT is at once, ASAP, immediately. Okay, so these are the terminologies, some of the terminologies that will be helpful in writing a concise PT document. So you don't need to write the entire word. Remember that the document should be concise, should be brief, okay, should be direct. Okay, so you will have to make use of the abbreviations and the medical terminologies. Now, please go back to Kettenbach if you forget some of them because this is very important. Next is the use of a template. So this template will actually differ from one facility to another. But one thing is for sure, okay, the template actually has the following, the name of the type of the PT document that you are writing. Could be either initial evaluation, could be either re-evaluation, okay, could be discharge notes, okay, could be progress notes. Okay, so you need to write what type of a PT note you're going to write. Okay, and then it shall include the patient's name. Okay, you should write the patient's name, or in some other instances, the patient's initials. Okay, you'll also have to write the date. Okay, and then what is the patient's diagnosis? So for instance, the patient has right adhesive capsulitis. Okay, and then if you look closely, the template is actually divided into 4 headings. Okay, the S stands for subjective. Okay, the O for objective, the A for assessment, and the P for plan. So notice that all major headings are aligned. S, the O, the A, the P. They are aligned. Okay, so you have to take note of that. Next thing that you need to remember is for you to avoid leaving blank spaces. Okay, so if you are going to write, for instance, for the subjective, so you're going to write your findings. So let's say, okay, write here, findings, you'll end here, and then write another, and then end here. Okay, you do not discontinue the entry. So you should write immediately after each finding. So you do not do right here and here, right on the next space. You do not do that. This is incorrect. Okay, so your entry should be a continuous entry of findings. So you do not leave blank spaces. Okay, so that's for avoid leaving blank spaces. Next thing that you need to consider is the use of person first, language. What is person first language? So if you take a look at our example, notice that each finding starts with patient. Patient. Okay, so patient claims pain started a week ago when doing laundry. You need to avoid, okay, using pronouns like he, she, I, them, they. Okay, we do not include them in the document. It is always person first. So patient, patient. Now, for you to avoid writing patient all the time at the beginning of, each sentence, you may want to write it this way. So patient claims pain started a week ago when doing laundry. Okay, and then you could add period and then reports pain on the anterior aspect of the right shoulder, etc., etc., etc. Okay, so for you to avoid using this patient at the beginning of each statement, then you may write it this way. Okay, next thing that you need to consider is the legibility of your writing. It means your handwriting should be clear, readable, legible. Okay, so you do not write this way dahil nagmamadali, patient reports. No, not this way. So you should write legibly. It should be readable. Patient reports, pain, blah, 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 blah. Okay? Another thing is the month, day, year format. Okay, so the first example is a correct entry. So it's complete. It has the month, it has the day, and the year. Okay, could also be in numerical format. So 8/13/2020, complete. Okay, it has the month, the day, and the year. Okay, so for the third one, it's incomplete kasi walang year. So you should always include all three, the month, the day, and the year. Okay, because the PT document is a formal or a legal document, you may only use either black or blue pen. But between the two, black is the more preferred one. Okay, another thing that you need to consider is the degrees and certification. What are the Okay, for the degrees and certification, these are the suffixes, okay, at the end of the examiner's name. So for instance, my name, okay, and the degrees. So already done with my master's, licensed PT here in the Philippines and in the US. So this one, certification and degrees. So I think we will be discussing this one in the next slides. Another thing that you need to consider or you need to know is how you correct your errors. So for instance, okay, you wrote in the document this, patient reports 5/10 pain on anterior aspect of right shoulder. And then you realized that 5/10 is an incorrect entry. So how do you correct this? Okay, so you write the word error so that you'd know, or another a healthcare professional would know that 5/10 is an error. And then you write the correct finding, which is instead of 5/10, it's 6/10. And then you countersign, and then you write the date at which you corrected the error. Again, you write the word error, you write the correct entry, you countersign, and then write the date. Again, for the degrees and certification, just like a while ago, okay, so you need to include, if for instance in my case I'm done with my master's degree, so it includes MSPT right after my name. I am a licensed physical therapist here in the Philippines and in the US, so I'd like to include that also. And then your degree is physical therapist. Okay, if I were an intern, I would write my name. Of course, wala pa kayong degrees and certification kasi hindi pa naman kayo gumagraduate. And then right below my name, I'd write USTPT intern and then the year that I will graduate. Okay, so in your case, since you're still students and you're not yet interns, you write your name, and below your name, you write USTCRS batch 2022 or the year of your graduation. Okay, so very important. So from now on, if you will be asked to write an initial evaluation, okay, which you will be writing every session, especially in the laboratory, you use this as your title. Okay, so your name above, and then below your name, you write USTCRS batch 2022. Okay, again, before we move on, how many sections are there again in the SOAP format? There are 4. Okay, that is correct. And what are these 4 again? What are the 4 headings or the 4 sections of the SOAP format? 1 is subjective. Okay, 2 is objective. 3 is assessment. And 4 is the plan. Okay, so the first 2 headings, subjective and objective, are the bulk of our course, which is musculoskeletal examination 1, while assessment and plan will be discussed next term under MSK 2, or the musculoskeletal eval and treatment. So for now, here in this course, we are going to focus on the first 2, the subjective and the objective. Okay, so under subjective, we have the following. So remember, subjective is a major heading along with objective, assessment, and the plan. So under subjective, what do we find? Okay, so we have the following subheadings. So we start with the demographics, that's the first subheading, followed by chief complaint, the second subheading, followed by the history of present illness, followed by the past medical history, and then lifestyle. And then the physical and the social environment are interchangeable in terms of sequence. And then lastly, you have the patient's goal. So we will be discussing each subheading as we go along. Have the following data, okay, that will be included under subjective. Well, we start with the demographic. So this is the first subheading under S. S is the major heading. Demographics is the first subheading. Okay, so what can we find under demographics? So that is the name of the patient, Okay, so when writing a PT document, you don't need to write the full name of the patient. You only need to write the patient's initials. So in my case, that's KD. Okay, my age, okay, for instance, I am 17 years old. My gender, so remember that you need to include the symbols, the abbreviations, and the medical terminologies. So instead of writing the whole word for female or the whole word for male, you may now use the symbol. So this one is for, no, this one, okay, is for the females. Remember that, okay, the symbol or the plus sign or the cross sign is pointing down. Okay, this one is for the males. All right, to make the document brief and concise. And then, what's next after gender? The present general medical condition. So notice that under this, you have hypertension, diabetes, or asthma. So you don't need to write this, the present general medical conditions. You only need to include the specific medical conditions that the patient has. Does the patient have hypertension? Then you may write that the patient has positive hypertension, the patient has positive diabetes mellitus, or patient is asthmatic. Okay, and then what's next after present general medical conditions is the handedness. So is the patient right-handed, or if the patient is left-handed? Okay, so these are the data, the findings under demographics, the first subheading. The next subheading after demographics is the chief complaint. Ano ba ang nirereklamo ng pasyente? What is the very reason why the patient is seeking for physical therapy management? So the most common of all complaints is the pain, okay? Or sometimes the patient will complain of weakness. Sometimes patient complains of difficulty in moving or difficulty doing a particular task. For instance, difficulty walking, difficulty going up and down the stairs, difficulty standing up from sitting down, difficulty changing clothes, okay, and things like those. Okay, sometimes also patient complains of numbness or pins and needles sensation. Sometimes then, patient complains of limited movement. Okay, so when the patient comes to you, patient says, hindi ko masyadong naaabot yung mga gamit ko, yung mga gamit ko na nasa cabinet na matataas. Kasi hindi ko maitodo, mataas yung kamay ko. Okay, so pwedeng ganon yung mga complaints ng patient. Next subheading is the history of present illness. So ano-ano yung mga makikita natin or ano-ano yung mga dapat nating malaman, okay, for the history of present illness, or sometimes ina-abbreviate natin to HPI. No, ang pwede nating malaman is the events related to the injury. So how did the patient get the injury? How did the patient sustain the injury? Okay, paano niya nakuha? Paano siya na-injure? Is it because of falls? So you need to ask that. Is it because of chronic activity of the arm? Lagi niyang ginagamit? Is it because of, dislocation? And a lot more. So you need to ask the patient these questions. Okay? What else do we find under history of present illness? Okay, related to the injury, were there tests, labs, laboratory findings, medications, or treatment, okay, na ginawa sa patient related to the present complaint? Okay, may x-ray ba na ginawa? May CT scan, MRI? And so, kung meron, what are the results? Okay, Physical exam by the doctor. Again, you need to ask the results. Okay, EMG-NCV, this stands for electromyographic nerve conduction velocity test. If in case this was done, again, you ask the patient kung anong sinabi ng doctors na result. And then if the patient is taking pain relievers, if the patient is taking them, what are these pain relievers? Are they effective? Okay, so one important thing that you need to note of when asking questions or when probing the patient is you avoid questions. You avoid questions answerable by a yes or a no. Why? Because this will give you vague answers and you will be having a hard time documenting your findings. So, you don't ask, masakit ba? Oh, that's answerable by a yes or no. So, it's a no-no. Okay? So, you ask the patient questions that will make him or her tell you the story. Okay? And diskarte nyo, it is in the manner of your questioning, okay, that you will be able to extract the relevant information from the patient. Okay, again, avoid asking questions answerable by a yes or a no. What else? Avoid asking leading questions. Okay, so avoid that. You don't ask leading questions. Ano ba example ng leading questions? Hindi po ba kayo nagpunta sa doktor? So that is a leading question. Hindi po ba masakit? That is a leading question. Okay, so again, ask questions that will let your patients tell you the story. Next subheading after HPI is the past medical history. If HPI is anything related to the present complaint, past medical history is relevant medical condition in the past. So this will no longer concern the present complaint of the patient. Okay, so if the patient currently has supraspinatus tendinitis, okay, and the patient is complaining of shoulder pain because of supraspinatus tendinitis, anything related to that will fall under history of present illness. Now, if during your interview you found out that the patient previously had shoulder dislocation, then anything related to the previous condition, which is shoulder dislocation, will now fall under past medical history. So it's very important to probe your patients so that you'd know if the patient has had previous injuries before, because it will still matter. Okay, so what else will be under past medical history? Previous PT treatment. Again, this is now related to the conditions in the past. Okay. Next subheading is the lifestyle. So what will be under lifestyle? Okay, the patient's occupation. There are musculoskeletal conditions that are occupation related or occupational. Okay, so for instance, pitchers, they are very prone to having shoulder dislocation. Secretaries, or what we call the clerical work. Okay, those who are doing clerical works are very prone to having carpal tunnel syndrome. So very important that you ask for the patient's occupation. What else? The vices of the patient. What are these vices? Cigarette smoking is one. And then alcoholic beverage drinking. For cigarette smoking, you'd ask how many sticks per day. Okay. For alcoholic beverage drinking, you ask the frequency ng pag-inom ng patient. So, how often does the patient drink alcohol? And then, finally, the hobbies. Because sometimes, dito din nagkukos yung injury. For instance, hobby ng patient, sumayaw. Okay, so pwedeng dito niya nakuha si ankle sprain. Hobby ng patient, maglaro ng basketball. Pwedeng dito niya nakuha si ACL injury. Okay, so things like this. Next is the social environment. So what are the important information that you need to extract from the patient for social environment? Okay, sino ang kasama sa bahay? Okay, sino ang kasama ni patient sa bahay? This one is for you to be able to establish one, okay, family support or social support. This one, the social environment, will help you in making your goals in the assessment part. Okay, so very important that you will be able to establish this. Okay, the next one, the next subheading is the physical environment. So what are the information that you need to extract from the patient? Okay, for physical environment, home setup. Okay, could be home setup, could also be work setup. Okay, so very important for home setup or work setup, the distance. For instance, distance ng bedroom to the nearest washroom. Okay, distance of the main door to the bedroom and all those. Okay, of course, you only need to ask this if it is relevant. If your patient has an upper extremity condition, then I don't think this will be relevant. Okay, relevant lang ang distance kapag lower extremity ang kaso. Okay, architectural barriers. So, for upper extremities, for instance, overhead cabinets, to pinaka-common. But you're not only limited to asking presence of overhead cabinets at home, ha? So, you also need to think of other information or other architectural barriers that you think are important na magather mo, okay, for your patient. Furniture, okay, pwede rin related dito yung overhead cabinets. Or type of walking surface, is this cemented? Okay, is this carpeted, whatsoever? Well, of course, this one will matter if your patient has a lower extremity condition also. Okay, so you only need, again, to ask relevant questions. Okay, so if you have an upper extremity condition, then you don't need to probe on activities or architectural barriers concerning the lower X. Okay, only focus on the affected extremity. Next, okay, the last under subjective is the patient's goal. So, the question that you need to ask here is the patient's expectations in terms of, the complaint at the end of the PT session. So, most of the time, the patient will tell you na gusto lang niyang mapababa yung pain level because he wants to be able to go back to work as soon as possible. Or sometimes patient will tell you, I want to go back to playing tennis again, or I want to go back to playing basketball again. So it's very important that you ask for the patient's goal, because this goal, your patient's goal, and your goal as PT for your patients should match with your long-term goal later on. So this is how the entire subjective heading or subjective part of the SOAP format would look like. So notice, okay, notice that you have here the demographics. So you have here the initials, You have here the age of the patient, the present general medical condition, the handedness, and the gender. So all are present. So that is complete. Okay, so this is the demographics right here. Okay, what else? Following the demographics, you have here the chief complaint. Okay, complaints of inability to walk and no, bear weight. Okay, on the left lower X. It's just a typo. This is weight bear. Okay, on the left lower X. Okay, following the chief complaint, you have here the HPI. So notice for the demographics and the chief complaint, wala ka ng heading. Wala ka ng subheading. But for HPI, look at that. Okay, naka-subheading. And then colon. And then the finding. No, condition started 2 months ago when patient suddenly slipped during dance rehearsal. So take note. The PT asked when it happened. So it happened 2 months ago. The PT asked how it happened. So it happened when the patient slipped during dance rehearsal. Okay, and then the PT made the patient tell the story. So reported to fall on the floor with extended legs. So the manner of falling was asked. And then all the necessary information was also asked. Okay, pain felt at that time was also asked. And then patient was asked where he or she was transported or what was done to him or her right after sustaining the injury. So the patient told the PT that he was brought to the Makati Medical Center. Okay, the manner of transportation was through ambulance. Okay, ancillary procedures. So the patient told the PT that he underwent X-ray and MRI. So this one, the ancillary procedures, very important. And then the PT asked the patient regarding the results, okay, of the ancillary procedures, the X-ray and the MRI, to which the patient told the PT, the doctor told him he has left pulled hamstrings. Okay, so patient was advised by MD or by the doctor to rest, okay, take medicines and to undergo PT. Okay, and then following HPI, you have here the past medical history. Again, you write the subheading and then the entry. So for this case, no, the patient, okay, has not had any previous injuries before. So this is the first time that the patient sustained an injury. Okay, so right after past medical history, you have here lifestyle. So you see that the patient is non-smoker and non-alcoholic beverage drinker. So the PT asked if the patient is smoking, if the patient is drinking alcoholic beverages for vices. Okay, the PT also asked what the patient is doing for a living. So the patient is a businessman. Okay, the PT also asked the patient his or her usual activities. Okay, like his or her hobby. Patient is a dancer or dancing as a hobby. Okay, every weekend. And then right after lifestyle, okay, right after lifestyle, you have the physical and the social environment. So notice na dito pinagsama niya yung dalawa. Okay, pwede naman or pwede rin naman paghiwalayin. Okay, so lives with family in a 2-story house with stairs, approximately 15 steps, with handrail on bilateral sides. Remember that this is a lower extremity case. That's why the PT asked for the house structure, 2-story. Okay, and then stairs, very important for lower extremity cases. Okay, and then we have here right after physical and social environment, the patient's goal. So what's the patient's goal? To be able to walk again. Okay, so this is actually an incomplete subjective eval. So there are still a lot of information missing. So as PTs, you really need to step up and make the subjective part of the SOAP very comprehensive. Okay, so I can still pinpoint kung ano pa yung dapat na information na kasama. Okay, so dapat complete kayo kapag nag-i-interview kay patient. Okay, after the subjective part, we now go to the next major heading, the objective part. Okay, so what are the different subheadings, okay, that we will expect under the objective heading? So first is OI, or the ocular inspection. So under ocular, you have manner of arrival, you have body type, you have mental status, attachment, skin integrity, presence of swelling, are there postural deviations, or are there gait deviations? Okay, so under manner of arrival, you have a bedbound. Bedbound meaning your patient is restricted to the bed but can still restricted to the bed because of attachments. Okay, for bedridden, the patient is restricted on the bed because of the medical condition. Bedfast, patient is bed restricted following the doctor's advice. When you say wheelchair-borne, the first time you get to see your patient na dinadala sa clinic, naka-wheelchair. Okay? Stretcher-borne naman kapag nasa stretcher yung patient kapag dinala sa clinic. When you say ambulatory without or with assistive device, pwedeng the patient is walking, the patient can walk either without assistive device or ambulatory with assistive device. So how do you document that? Could be okay, ambulatory with, okay, you don't need to write assistive device anymore if the patient is using an assistive device. Okay, you only need to specify what assistive device the patient is using. So it could be ambulatory with bilateral axillary crutches. Okay, if the patient is ambulatory without assistive device, then you may write ambulatory without, okay, assistive device. Okay? Alright, so for the body type, you have ectomorph, mesomorph, endomorph. When you say ectomorph, the patient is very thin. When you say mesomorph, the patient is muscular. Endomorph, the patient is fat. Okay, for skin integrity, ano yung itsura ng skin? Is it dry? Is it pale? Is it shiny? You know that a shiny looking skin could mean that the patient has a sympathetic nervous disorder. Okay, does the patient have swelling? Okay, does the patient have attachment? May IV line ba yan? May bandage? Nasaan yung bandage? Or may catheter? For mental status, is the patient conscious or is the patient awake? Is the patient alert? Okay, coherent, cooperative. Is the patient oriented as to person, place, and time? Okay, so you ask that person, no, where are you? Who are you with? What time is it? Okay. What else? Do you see any postural deviations or gait deviations? Now for postural deviations, what you will be documenting under ocular are the deformities. Okay, so yung pangalan lang ng deformities. Okay, for instance, you have positive, genovalgum. Could be. Pwede rin siya sa postural analysis. Pwede rin naman, halimbawa, positive funnel chest. Okay, so papangalanan mo lang yung deformity. So it's very important that you know the name of that particular deformity. So for gait deviations, you only write presence or absence of gait deviation. So if you noted gait deviation, susulat mo lang positive gait deviations, and then you write here C, gait analysis. Kasi sa gait analysis mo talaga siya i-specify. For postural deviations then, pwede rin yan, no? Positive, okay, postural deviations, and then C, postural analysis. That's for the specific. Okay, but for the name of the deformities, you write it under ocular. So how will this look like now? Okay, for the ocular, for instance, okay, let's write O, okay, OI, and then you have the greater than sign, and then for manner of arrival, let's say the patient is ambulatory without assistive device. Okay, patient is a mesomorph. Okay, patient also has a positive, dry, and shiny skin on right ventral forearm. Okay, patient also has an IV line on dorsum of right hand. Okay, pwede rin patient is oriented as to person, place, time. Okay, patient is also cooperative. So it depends, no, on the findings that you got from the patient. Right? What else? If patient has swelling, so swelling, positive swelling on anterior aspect of right shoulder. Diyon. And if you noted postural deviations, can be positive postural deviations, and then CPA. So make sure that you have a comprehensive postural analysis for this. And then if you noted gait deviations, then you may write positive gait deviations, and then C, gait analysis. Make sure also that you have a comprehensive gait analysis. Okay, so that is how the ocular inspection will look like when documented. Next, after ocular inspection, you have palpation. So, a lot, okay, are included under palpation. So, you have muscle tone. So, how does this one look like now when documented? So, just like OI, no, you write O, okay, colon, and then palpation. Remember to write the entire word because you don't have an abbreviation for palpation. And then the greater than sign. So what do we expect under the palpation? You have one muscle tone, crepitations, tightness, warmth, okay, muscle spasm, muscle guarding, edema, tenderness, nodules, taut bands. Okay, so how do you write your findings? For muscle tone, let's say it's normotonic. So you just write normotonic on major muscles of bilateral upper X and lower X. Okay, now if you noted hypertonicity or hypotonicity on a particular muscle, then you need to specify that. Okay, what else? If you noted crepitations, then positive crepitations. And then include where? Let's say on right shoulder. And then include the action at which you noted the crepitation. Okay, so for this one, crepitations on right shoulder during, let's say, passive shoulder flexion. Okay, if there's tightness, then you write positive tightness and then you specify anong muscles ang may tight. Positive tightness of the right biceps brachii. Okay, so what else? Warmth. Okay, so for warmth, you may document it as, is it normothermic, that's normal temperature, is it hyperthermic, okay, high yung temperature, or hypothermic. So let's say normothermic, no, normothermic, okay, on, let's say, anterior aspect of right shoulder. Alright, muscle spasm, let's say positive muscle spasm of, let's say, right upper trapezius, or positive muscle guarding of right upper trapezius. Okay, so what is the difference between the two, muscle spasm and muscle guarding? Muscle spasm is noted even when the patient is at rest. Okay, so the muscle is already spasmodic. Okay, secondary to pain. And then, how do we define muscle guarding? So, it is muscle tightness, okay, or contraction of the muscle because of pain due to a movement. So, muscle spasm, even at rest, the muscle is spasmodic. Muscle guarding, you only note muscle guarding during active movement. Okay, what else? If you noted tenderness, okay, so that is positive. You have gradings, ha? Grade, let's say grade 1, tenderness on right upper trapezius, for instance. Okay, when you say grade 1 tenderness, grade 1, this is just pain. Okay, when you say grade 2, this is pain plus wincing. Okay, so may movement ng eyes. It's as if the patient is really in pain. Grade 3 is pain plus wincing plus withdrawal. So, tatanggalin niya yung part na masakit. Okay, iaalis niya. And then grade 4 is what we call the touch me not. So, hindi na siya magpapahawak because it's really very painful. So, it's important, okay, to remember that all elements should be present when grading tenderness. Okay, so both pain and wincing should be present if you're going to give it a grade 2. Okay, all three, the pain, wincing, and withdrawal, should be present for it to be grade 3. Okay? What else? Nodules, thought bands. So, you noted nodules, thought bands again on the upper trapezius. How are you going to document that? That's positive nodules. Okay, and thought bands on the right upper trapezius. Okay, so that's how it will look like. So it will get longer and longer as you get more comprehensive with your examination. Okay, for the anthropometric measurement, I actually have a lot under it. So you have one limb girth, stump measurement, chest expansion, and then the leg length. So for MSK1, I think we're only going to focus on limb girth and the leg length kasi you have a separate course for I think stump measurement for amputated patients or amputees and chest expansion that will be discussed in another course naman. Okay, so for the leg length, you have two types, the true and the apparent leg length. So how do you tabulate your findings? So again, okay, that's O, okay, O, and then colon, and then anthropometric measurement, okay, and then you have here the findings. So you are going to tabulate it for easier reference or easier understanding. So for true leg length, tabulate it, you have the left, the right, and then you get the difference. For the apparent leg length, you also do the same and just create another table. Okay, and then just create another table, and then here, and then you write here apparent leg length, and then again the laterality, the left and right, and then you get the difference. Okay, so that's just it for the anthropometric measurement. How about for the limb girth? Okay, for the limb girth, okay, under O, you could write here no anthropometric measurement, you have leg length, because another entry is for limb girth. Limb girth of, let's say, right upper extremity. And then you have here, I think the starting point for the upper extremity is either the olecranon or the epicondyle. So if you're going to use the olecranon process, okay, as your reference, you go 2 inches above, okay, 4 inches above, or you want until 6 inches above, okay, 2 inches below, 4 inches below, okay, 6 inches below, and then you write your measurement. Okay. For the range of motion, this is how you're going to document it. So notice that dapat merong O if you're going to write it individually, no? O, colon, and then range of motion, and then the greater than sign, and then this heading is constant, so you always write this heading. Okay, all major joints of bilateral upper X, lower X are within normal limits, actively and passively done, pain-free, with normal end feel, except, so all findings that are abnormal should be tabulated. So how will it look like? So you tabulate it, divide it into 4 columns. The first column will be for the movement. So that's the right shoulder flexion or left shoulder flexion as an example. The second column for the values of our active range of motion. The third column, values for PROM. And then the fourth and last column will be for the end feel. So always, okay, for this example, always write the degrees. Degrees, 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 degrees. Okay, so that's how you're going to document range of motion. Okay, for the MMT, so you have here the MMT, which is the subheading, followed by the greater than sign. And then this, just like your range of motion, this one is a constant. So you always write the heading. All major muscles of bilateral upper X, lower X, and trunk are graded 5/5 except, so all muscles that are not graded 5/5 are already considered abnormal. So those findings with abnormal muscle strength are what are the muscles that you're going to tabulate. Okay, so you just need two columns. The first column for the muscle group or the specific muscle, and then the second column will be for the muscle grade. So for right supraspinatus, you have 3/5. This is abnormal. And then left shoulder flexors, you have 4/5. So notice that the two actually differ because the first entry is a specific muscle. Now, if all of the shoulder muscles except one, okay, is abnormal, then you need to specify the name of the muscle. But if you notice that all of the shoulder flexors, okay, you have the biceps brachii, you have the anterior deltoid, kung lahat sila 4/5, then you don't need to write the specific muscles. You just write the whole muscle group, shoulder flexors. Okay? Next is the special test. So how are you going to document that now? Okay, just like the rest, you just need to write, okay, the heading, which is O, colon, and then you write special test, and then you go straight to your findings. It could either be just a positive or a negative special test. Okay, so could be, for instance, you did empty can test and you find out that the patient is positive. Okay, after doing empty can test, then you just write positive and then write the name of the special test. Okay, that's the empty can test. And then you write the laterality on right. Okay, so don't forget the laterality when needed. Okay, for sensory testing, notice that the findings were written as follows. So you see that O, the subheading is written. Okay, another subheading, which is the sensory testing, is written. Okay, and then the usual heading, intact sensation as to light touch, pain, pressure, and temperature, using, remember, sinama dito yung sensory modalities used like the cotton, thumb, pin, and test tubes on bilateral upper X and lower X and trunk, except, and then the finding is there's 20% sensory deficit as to light touch on right anterior shoulder. Another for deep sensation, okay, so the heading would be intact deep sensation as to proprioception and kinesthesia, except, for instance, the patient was not able to identify vibration. Then the abnormal finding is written as, vibration, and then the PT described here, in parentheses, was not able to identify in 5 trials, meaning the PT gave the patient, 5 trials to identify if he or she can feel the vibration. So with this, was not able to identify in 5 trials, so 0 out of 5. In 0 out of 5 trials, hindi na identify ng patient yung vibration. Okay, so in 5 trials, for instance, the patient was able to identify only, once, then you say, was able to identify in 1 out of 5 trials. Okay? Okay, for deep tendon reflex, okay, so you have here, you have 2 ways of documenting it. You can write it down or you can use figures. Okay, so the first method is widely accepted. Okay, so that's O, O, and then deep tendon reflexes, and then the greater than sign, and then you write it. Is it normoreflexive? Okay, is it hyporeflexive? Is it hyperreflexive? Okay, and then write where on bilateral upper X and lower X. Okay, this is widely accepted. The other method of documenting deep tendon reflexes is by using this figure. So notice that you have here the plus sign outside. So this one, this part here outside will represent the triceps. Okay? When the plus sign is written inside, this one now will represent the biceps. Okay? When the plus sign is written inside here, this one represents the wrist, okay, flexors. And when it is written outside here, it represents now the wrist extensors. Okay? Just the same for the lower extremity, when the plus signs are written outside, written here, no, here. So this represents the knee extensors. When it's written inside, it represents the knee flexors. Okay, and then for this one, when it's written outside, this is for the ankle plantar flexors. And when it's written inside, it's ankle dorsiflexors. Now for the legend, if you're going to use the figure, you have to write the legend here, no? Sa baba, legend. Okay, so you have 1 plus sign, 2 plus signs, okay, 3 pluses, and then 4. Okay, 1 is hyporeflexive, 2 is normoreflexive, 3 is hyperreflexive, and then 4 is clonus. Okay, I forgot to include here 0. Okay, this one is absent reflex. Okay, so this one now is your legend. So don't forget to write the legend if you're going to use the figure. Okay, for postural analysis, you have 3 views. So how are you going to document that? So that is again O, and then postural analysis. Okay, and then all landmarks are leveled except, and then you tabulate. Okay, divide it into 3 columns. Okay, the first column for the anterior view, second for the lateral view, and the posterior view. So remember to only write all relevant findings related to the anterior view, related to the lateral, and related to the posterior view. Okay, so walang mami-misplace na findings. Again, when writing findings, okay, postural analysis, you start from the head down to the feet. That is when you are writing your findings. But when you are assessing, you start from the feet up to the head. Okay, a whole lot of difference. Okay, lastly, we have the functional analysis. So what are we after? You have the ADLs, bed mobility transfers, endurance, balance and tolerance. Okay, you have the following outcome measure tools, which we will be discussing in detail in the succeeding sessions. So for FA, how are you going to document that? So you write O, and then you write FA, and then greater than sign, and then this is a constant also, the heading, no? Independent in all aspects of ADLs, okay, bed mobility, and transfers, except. Okay, and then you write the findings. For instance, you have moderate plus 1 assist, okay, on pelvis in sit to stand. Okay, so that is a finding, no? How about balance and tolerance? So for balance and tolerance, you have grading, no? So you have, for balance, you have both static and dynamic balance. Okay, so you have for both, you have poor, you have fair, okay, you have good, and you have normal. Now, I want you to go to O'Sullivan, your O'Sullivan book, Physical Rehabilitation, and check for this one. Na kay Sullivan po yung grading. When will you say that the patient has poor static balance, poor dynamic standing balance, or fair, or good, or normal? For endurance, how are you going to document endurance? So you just write, okay, patient was able to walk for, you write the time, let's say 10 minutes, no, without rest. Okay, so that is endurance because you have the duration or the time component right here. And you included if the patient was able to do it continuously or with interruptions. Okay, so how will the entire O look like? So you have here O, right? O, okay, and then colon, and you have here ocular inspection, and then the greater than sign, and then you write your findings, followed by palpation, greater than sign, and then you write your findings, and then you have, for instance, ROM, greater than sign, findings, MMT, greater than sign, and then findings, special test, greater than sign, findings, postural analysis, greater than sign, findings, gait analysis, findings, functional analysis, findings. So notice that all subheadings are aligned. Okay? All major headings will now be aligned. So O, and then A right here, and then P. Right? So for the entire document, you don't need to write O each time. You don't need to write O, ocular inspection, findings, and then another one O, palpation. No, you don't need to do that. No, one O is already enough. Only during quizzes, because you will be asked naman per ano lang, per subheading. So, each time sa quiz, isusulat nyo kung saan siya. Kung O, ocular inspection, and then findings. Because this is number 1. Halimbawa, number 2, you're asked again, O. And isusulat mo ulit, O, palpation, greater than sign, and then findings. Okay? But if you're going to write it in the whole document, you don't need to write O each time. Okay? This will suffice. Okay, thank you. If you have any questions, you may write them down sa blog, sa course site, lecture. Okay, kay Module 2, Documentation and Physical Therapy. Nandun yon. Pakisulat yung questions. I will check the discussion board on Friday or Thursday to make it earlier. Thursday to check yung discussion board, and I will respond to your questions there. Okay? Thank you.